Okay, this is an example of a patient who has come to you, who wants to talk to you about the treatment plan, and your task is to go and speak to the patient, address her concerns. This is young female. We need to keep this in mind. 40 years old female who has been diagnosed with the breast cancer, and she had gone through all the process of discussion in the MDT, and she is well aware of the management plan. She is well aware of the diagnosis. Now she has come to you with a few concerns. So just looking on the picture, looking on the scenario, it looks like this is someone who might want to know a bit more about the treatment, about their options. She might want to discuss about the sport. So we need to find out, or she might not want to go ahead with the treatments. Young patient having cancer, it can be very stressful because based on the life expectancy for someone to have the breast cancer and maybe going through the process of chemotherapy and mastectomy can be very stressful. So in this case, when you see such scenario in the exam, the patient usually asks you about not going ahead with the treatment, which essentially is their right. They have the autonomy. They can decide if they do not want to go ahead with the treatment. But we need to explore a bit more about their feeling, how they're feeling. So go, greet, introduce yourself, check the identity of the patient, and find out why she has come to you. You can ask by simply saying that, how may I help you, or I can understand you come to the hospital or to us to get answers of your queries. So explore why the patient has come to you. Try to make a list of them before you start talking, and then you address one by one all the concerns. Rather than you ask one concern, then you start talking about that, then you ask is any other concern, then you start talking about that. Better, the good way is to ask all the concerns. May I know what you want to know? The patient may tell you, doctor, I want to know what are my options, uh, what can happen to me if I do not go ahead with the treatment, and I'm worried about the mastectomy that your team or the MDT has suggested, because I have no life. I don't think that there will be any attraction in me if I lose my breast, and I know that I may lose the hair as well. So I don't see any beauty, any attraction, and I'm very much feminine person where I see, and I'm beauty lover. So when I have no attraction, no beauty, I don't think that there will be any life for me. And she may tell you about the profession. If not, it's better you ask. The patient may be linked or connected to the showbiz. She may be one of the models, she may be bar dancer, we don't know. So try to explore how this diagnosis and the proposed treatment is going to affect this patient as well. That's very important. So we need to address every single aspect of the life, and also check their mood, check their esteem in the life. Usually, such kind of patients can become very depressed, imagining and thinking about losing the breast, losing the social life because of the requirement of the treatment, mastectomy, hospitalization, chemotherapy, radiotherapy, all those things. Then risk of getting the infections. So the life may look very different to them and very difficult to them. So we may need to provide them support. So usually those patients are at risk of developing severe depression, and they can sometimes be suicidal. It is important that we address and we provide them the support. The options that we can offer in answer to losing the breast are, the patients can be referred to the surgeons for the breast implant. That's one option, and they can also wear artificial breast. And similarly, for the hair loss, they can use the wigs. That's another option, and there are different types of wigs available. You can put them through different forums. If the patient is feeling depressed, it's important that we offer them mental health support, and we offer them some platform where they can discuss their problems, and they can get the support, right help on right time. That's very important. So in this particular scenario, I would say you guys need to focus more on towards trying to find out if the patient is depressed, if the patient is suicidal, and if the patient has any questions relating to the mastectomy, losing the breast, losing the beauty. So we can offer them such platform where they can discuss their situations with the different patients who went through the similar problem, and also mention to them that breast cancer is kind of curable if it is treated on time, and all the seeds of the cancer are gone, taken out, then the patient can live very good life. However, they may need to get some further help to like the breast enhancers and implants, so they will be helpful for you to go to live a social life. The patient may be concerned that I will not have any attraction, a female attraction or the beauty. It may be someone who has a big fan following because of their beauty, because she is a model. So all those things can be very distressing. You can ask them to, you can explore if there is any other option for them to go to work, and if you support them psychologically, this is how you move forward in such situations. And I don't think that there will be much trouble, so it is not going to be a big challenge if you find this scenario in your exam, as long as you follow my advice. Thank you.